Greeting everyone. My name is Muhammad Imran bin Jamaluddin. My matric card number is 3144001071. Today, I would like to present about tuberculosis infection case study. The aim of the diagnosis is to learn about tuberculosis. Second is to learn how tuberculosis can be diagnosed and to raise awareness of the tuberculosis in society. For the last is to prevent from getting tuberculosis infection. Before I continue with my case study, I would like to have an introduction about tuberculosis. Tuberculosis is an infection disease caused by the Mycobacterium tuberculosis. Tuberculosis is generally affect the lung, but can also affect other part of the body. To affect other part of the body, it can travel through the lymph node to go other part of the body. Tuberculosis is spread through the air when people who have TB in their lung by cough, spit, speak, and sneeze. Prevention of the TB involves screening those at a high risk, early detection and treatment of the case, and vaccination with the Bacillus camelid urine vaccine. This vaccine is for tuberculosis. For my case study, a 58 years old female who lived in Shah Alam presented to be outpatient clinic following with a 2-month history of cough with low-grade fever in the evening. She also had several episodes of the hemoptysis within this time. She also had experienced right side chest pain and also pain with the breathing or coughing. After meeting her physician, she been transferred into the ward for observation and treatment. To diagnose the tuberculosis, there's 2 mandatory tests that can be done to detect the tuberculosis. First is X-ray or CT scan. This patient has been sent to have a X-ray and the result present of the pleural effusion on the right side of her lung. Second is AFB smear, which is mean acid vascular smear. The result is positive by presence of the red color rod. Here we can see the red color rod at the point of the red color arrow. Ethical consideration. Providing healthcare workers with the adequate protection is the key factor in having a healthy and committed workforce. Access to diagnosis and treatment for children need to be expanded to reach all in need. Human rights and the imperative to protect greater good of the public health may call for the increased regulation of the private sector. Industry should be given further incentive to develop new tools for the TB control. For the treatment, medication are the cornerstone of the tuberculosis treatment. But treating a TB takes much longer than treating other type of the bacterial infections. With tuberculosis, you must take antibody for at least 6 to 9 months. The exact drug and the length of the treatment depend on your age, overall health, possible drug resistance, the form of the TB, which is either latent or active, and the infection location in the body. If you have a latent tuberculosis, you may need to take just one type of the drug. Active tuberculosis is particularly if its drug resistant strain will require several drugs at once. The most common medication that used to treat tuberculosis is isoniazid, rifampin, ethambutol, pyrazinamide. For your information, latent tuberculosis infection is mean this patient is infected by Mycobacterium tuberculosis, but the patient does not have an active tuberculosis. Medication side effect. A serious side effect of TB drug aren't common, but can be dangerous when they do occur. All tuberculosis medication can be highly toxic to your liver. When taking this medication, call your doctor immediately if you experience any of these following. First is nausea or vomiting. Second is lost appetite. Third is a yellow color to your skin, which is a jaundice. A dark urine, and a fever that lasts 3 or more days and have no obvious cause. The significance of the study. We can learn how bad untreated illness can be. Second is learn how to prevent from getting the infection. Personal development. I can learn what kind of tests should be run if cases like this appear. Learn how to take a good care of our body. Can learn so much more about one of the most famous diseases that take thousands of lives every year. This is the new technique to detect tuberculosis. This technique called interferon assay. This test measure the amount of the interferon gamma in the blood on stimulation by Mycobacterium peptide. The amount of the interferon gamma increase in the blood. This test different from the conventional BCG test, as it uses protein known as ESAT6 and CFP10, which is present in the Mycobacterium tuberculosis but absent from all BCG strains and from most non-tuberculosis Mycobacterium. It is intended for use as diagnostic aid for Mycobacterium tuberculosis infection, including both tuberculosis disease, latent tuberculosis infection. For discussion, Mycobacterium tuberculosis is referred to as an acid-fast bacilli because acid-fast organism is like Mycobacterium contain large amount of lipid substance within their cell wall called mycosalic acid. This acid resists staining by ordinary method such as gram stain. Acid-fast stain such as zinisen or fluorescent stain such as uramine are used instead to identify Mycobacterium tuberculosis with the microscope. Humans are the only known receiver of the Mycobacterium tuberculosis. A misconception is that Mycobacterium tuberculosis can be spread by shaking hands, make a contact with the toilet seats, sharing food, ordering, and sharing toothbrush or kissing. It can be only spread through the air droplet originating from the person who have disease, either coughing, sneezing, speaking, or singing. Thank you for listening.